9:40 on the clock. A very good morning to you. Now, the reason why I asked you to kind of hold on to your radio sets, to kind of gather the women in your family, your loved ones, to listen to this a little closely than you already do, is because we are joined by Dr. Amna Khushnud. Now, she's a consultant family medicine at the Fakeeh University Hospital, and she's here to talk to us about cancer, about cervical cancer, about breast cancer, lung cancer, and the list is endless. Good morning, doctor, and welcome to the show.
Good morning. Thank you, and pleasure being here.
Well, first things first, as a consultant family medicine doctor, now what are the recommended cancer screenings that you kind of talk to your patients and ensure that they religiously follow them?
So, in terms of the cancer screening, it's an ever so evolving topic. We are right now, the screening programs that are available worldwide are basically cervical screening, breast cancer screening, colorectal screening, and lung cancer screening. And these are like one of the most sort of commonest cancers as well.
Could you talk to us a little bit about the different methods of screenings for, say, example, a lung cancer, and how do patients know that they are going to be eventually affected by it?
Mm-hmm. So the leading cause of death in cancers is essentially the lung cancer. So this is, and the most common sort of symptoms that we're talking about is cough, having a bit of blood while you're coughing, or recurrent infections. 85% of cancers are lung cancers are because of smoking, so that's a major risk factor. But also, there are other risk factors. For example, having a bad air pollution, etc. Above the age of 50, or if you're a smoker or you have been smoking, in the last 15 years, you are going to be offered, as a family medicine consultant, if you come to me or any other medical consultant, they will offer you a low-dose CT scan to basically look whether there are any changes in your lungs, and that's how we normally do it, and it's basically done yearly.
Right. So one must take a look into their habits, their lifestyle to know whether they're heading there or not. And that's for lung cancer. What is cervical cancer?
So cervical cancer is essentially a cancer of women's cervix, which is located next to the uterus. Now, the good thing about cervical cancer is there are vaccines for it. So an HPV vaccine, which is normally given between the age 9 to 14 years, so very early on these HPV vaccines are given. But also you can have this vaccine anytime, really, if you've not been exposed. So the evidence that this vaccine is going to work fully after the age of 25 is, the evidence isn't very strong. However, it's still recommended that you take it if you have not had it in your sort of childhood or teenage years.
So there's been this scare around breast cancer, although there is a lot of knowledge that has been imparted by various mediums, various sources. But the scare is, what if I go for a mammogram? What if I go for a screening and I get to know that I have breast cancer? Which is why women never really opt for it, even though it is becoming a very common point of discussion these days. What do you have to say around that?
Absolutely. For patients, we have to, or anybody, if they're going to be diagnosed with cancer because they just went for a screening, it's such a grim news, isn't it? However, the sooner it's caught, it is treatable. So, so many of cancers, the whole purpose of screening essentially is that, it's caught early and it's treated early. Because if it's going to be treated early, the mortality rate, you're going to live perfectly healthy life with it, and there are not going to be any sort of side effects, or it's not going to, as long as it's not spread. So I would say that for women, just please do your breast examination yourself if you've got any problems, any issues, pain, any lumps. Most of the lumps are not cancer, but what if it is? Just go to your doctor and get it caught early. So earlier, if you're going to catch it early, we're going to treat it early, and you're going to be all right.
Absolutely. But then is there a cure, doctor, for cancer, or are we headed to that way?
Absolutely. That's what I'm saying, that, the whole purpose of these screenings is to catch it early. And once you've caught it early and you've treated it, you're fully cured. You don't have to be on lifelong medication. You don't have to, it can be fully cured. But also it depends on at what stage it's caught. That's where the screening comes in.
Right. And how often must one visit their family doctors to kind of get an understanding of their body? Are there certain tests that, we as an individual, lay people must perform regularly to know maybe our levels, our blood levels are, in check to make sure that everything is hitting the mark?
So there is absolutely, you need to visit your family doctor, and that's the whole point of having a primary care, because what it is that your primary care doctor is going to be looking at you from head to toe. So they're not like a cardiologist or respiratory doctors who is just going to look at one organ of your body. Family medicine consultant looks at you as a whole, including all the organs. So definitely some blood tests, like getting your liver screening, getting your kidney screens, full blood count, things like that is definitely important, at least once yearly, or as soon as you develop any symptoms where you feel a bit tired, you feel a bit, or as soon as you develop any symptoms where you feel a bit tired, you feel a bit fatigued, you're losing weight, if you're coughing, if you're having some bleeding when you shouldn't be bleeding, anywhere in the body, any lumps or bumps you see in the body, night sweats, getting unwell frequently. So the list can go on. And hence why you have to see your family medicine consultant at least, I would say, once a year, especially starting after the age of 30. Before, it used to be like, start your health check after the age of 40 or 50. But now we know that the cancer is quite prevalent in young people as well. So, just...
How young is young, doctor?
I've seen breast cancer in 25 years old, in 30s. So like, I know that the breast screening internationally by WHO starts after 40, but you're not safe from any kind of cancer, and that's purely because of the lifestyle changes, the processed meats, the diet, less fruit and vegetables that we eat, that all contributes to it.
Right, absolutely. Doctor, you're talking to me about symptoms where lung cancer is concerned. But talk to me about cervical cancer, colorectal cancer, and breast cancer. Now, what should we be aware of? Obviously, in a nutshell, although you'll be talking to me, telling me to go visit my doctor, but the moment I know something is wrong with me,
Yes.
the instant reaction is, what? Getting onto Google and kind of searching it up there. And this is hazardous. Right? I'm sure you would have patients coming and kind of contemplating this with you, arguing with you, but Google said this. And so what are the common symptoms that different cancers kind of show?
Absolutely. When we do get a lot of patients, and there's such a scare outside as well, isn't it? Like, as soon as you Google some symptoms, the first thing that comes up is cancer, or you've got some sort of tumor, you've got some sort of cancer. Obviously, that's not the case in every scenario. It's the main symptoms or the symptoms of different cancers are different. So if you're talking about cervical cancer, it's basically having bleeding from down below, which is not your regular bleeding, having pain while having intercourse, and any sort of dull wake pain in your lower abdomen as a woman, which you think that it's not normal, it's not related to your normal physiological sort of period that you get. So that kind of thing is for the cervical cancer. You just have to go to your doctor and get the pap smear done.
Absolutely. Now, Doctor, we've got a question that has come in from one of our listeners, Azhar Khan. He says, please ask Dr. Amna, can you talk to us about the types of treatment available for breast cancer other than chemotherapy and radiation? Radiation and chemotherapy has a lot of side effects. What are better treatment options, please?
So chemo and radiotherapy, yes, unfortunately, they do have quite a lot of worse effects while the patient is on them, and it's quite strong drugs, and that's precisely how it sort of kills the cancer cells. Again, in terms of the breast cancer, there are so many. If it's caught early, you go for a surgery, and if the surgeons are able to excise the whole cancer, if it's not spread elsewhere in the body, then you don't necessarily need to go for a radiotherapy or chemotherapy. Maybe a couple sessions, and that's decided normally by your oncologist. However, if the cancer is spread, and if you've ignored it, you've not, or you just caught it late, and if you're one of those unfortunate people, and I understand it's such a sensitive topic, you would need chemo and radiotherapy, and that is the only thing that's going to help you at that stage. But earlier stages, you could just have it excised, you could just have that lump taken out if it's not spread.
Absolutely. Hoping that you've got your answers. And if there are any questions, please feel free to give us a call. We have Doctor for 10 odd minutes more before we say goodbye to you. 800-81003 is the number to call. Or if you want to stay anonymous, and I do understand these are very touchy subjects, 0586861003 is the number where you can message. Now, Doctor, I mean, I know we're talking about cancer. I know we're talking about the way forward. But you did mention about certain symptoms where cervical is concerned. Colorectal cancer, have we touched upon that already?
No, we haven't.
Okay.
And I would like to talk about it definitely, because the commonest symptoms that the colorectal people with having colorectal cancer, and a lot of us do experience that again, like sort of alternating diarrhea and constipation, having a bit of blood in your stool, again, lower abdomen sort of pain, feeling really tired, fatigue, weight loss, having iron deficiency, anemia, abdominal cramps, things like that. All of that could be the sign or a symptom of a colorectal cancer. The test for colorectal cancers are really, really simple. You have a FIT test or an occult blood test where we take a stool sample and we check it under the microscope whether there is any blood cells there or any, any sort of cancerous cells there. Further on, we can go and do a camera test from your back passage to look inside, because a lot of us, because I'm going to emphasize on the lifestyle again, we do get constipated, we do get diarrhea, we do get abdominal cramps because all the food that we eat.
Absolutely.
But that necessarily is not like 100% symptom of cancer that you've got constipation. So, you need to further go on to your doctors and, get yourself checked and be reassured that, this is not something sinister. Also, don't ever forget the family history of cancers is very important. So if your loved ones, like your mom, dad, your siblings, your aunt, uncle, first sort of, line cousins, if they have got any kind of cancers, you probably would be more prone to getting those cancers. And knowing your family history is very helpful when you're going to speak to your family doctor. Just let them know that, my uncle or my aunt's been diagnosed with a cancer. Could I please get the screening of this particular cancer, or as a whole, really?
So, for example, if, say, your grandparents or your parents, say, have breast cancer or they have lung cancer, does it mean that you would get the same type, or does it change?
So for the breast cancer, there is a particular gene, which is BRCA gene, which runs in the family. We know very famously Angelina Jolie had her mastectomy done because of this, because it run in her family. Most of the breast cancers are not like BRCA gene, but obviously they would need to know the history of their family. If your family has got cancer, the likelihood of you getting a cancer is a little bit increased to people who don't have their family history, who don't have any cancers in their family.
Right. Now, we got another question, doctor. It says, how is NK cell therapy for a cancer treatment or immunotherapy? All right. Is that a different sort of a therapy? Okay. We will kind of double check that and we will get back to you. But otherwise, we are talking to you about the risk factors that increase the likelihood of developing lung cancers, cervical cancers, and the other cancers that we just mentioned. So what are the risk factors, doctor, that involve in, that increase the likelihood of you getting these cancers?
So different cancers have got different risk factors, as we discussed earlier. But all of the cancers, you'll see there is a common theme for it, which is the lifestyle.
Okay.
Again, I'm going to talk about it. Obviously, not so much for breast and cervical cancer, but definitely for colorectal and lung cancer. For lung cancer, we have already mentioned, like any kind of air pollution, any kind of smoking is really a massive risk factor.
Right.
For colorectal cancer, majority of the times is the lifestyle, your weight, your dietary habits. Again, smoking is again one of the things. Alcohol consumption, if it's more than 14 units per, you have to drink in moderation. If you're drinking more, then obviously that also causes the liver cancer, which we're not touching on today because there are not proper screening for that at the moment. The list can go on and on. For the breast cancer, as we talked about, family history is one of the major sort of risk factors as well. One more thing that I would like to touch here on the breast cancer is that even if you have breast implants, you still can go on and have a you still should go on and have a mammography done, and get the screening done, because having the implants doesn't mean that you're not going to develop any cancers.
Oh, so is that a myth around cancer then?
In terms of, some people, I've had patients coming in there, oh, but doctor, I've got implants. So, obviously implants cannot get a cancer. But it's not the implant itself. Obviously, that cannot get a cancer because that's a synthetic outside material. It's not your body. But, you still have a breast tissue behind it, which can develop any kind of tumor in it. So even if you have, like a breast implant or whatever, you definitely need to go for your screening.
So, Doctor, I have one last question. We've reached the end of our show, but before we go, I want you to answer this. How do I cope with cancer diagnosis? How do I come to terms with it?
Very, very sensitive topic, and breaking this news to a patient is often very difficult for us as doctors as well. But having an open and honest conversation with your patient, just have a chat with the doctor who's breaking the news, ask them all the questions, and we are more than happy to answer anything. Also, I understand that when the news is when we break the news, you probably would be in a shock at that time, because it's not an easy news. It's a very heavy news, isn't it? You can go back to your doctor as many times you want to have a chat about it. And that's what we are here for, the oncology team, the family medicine team. We will be with you throughout the journey, and we will take care of you. And I understand that it's so difficult for people, for anyone who's had cancer. But trust me, your medical doctor, your doctors are there to help you, and we will be with you throughout your journey.
Loved the way you kind of ended the conversation. It gives me a peace of mind that yes, I am in safe hands, and that's exactly what you want your patients to know, that they are in safe hands. But they've got to take the first step, right, Dr. Amna?
Absolutely. So that's the whole reason. Please do come for screening, even if you're going to be diagnosed with some horrible thing. We are there to treat that. A lot of cancers these days with medical advancement are treatable. So don't ignore your symptoms.
So we have a lot of them asking us for your details. Now, where can our listeners find you if they just want to come for a regular checkup? Doctor?
Absolutely. So I work as a family medicine consultant in Fakeeh University Hospital, which is based in Silicon Oasis, and I'd be more than happy to have more chat or more detailed discussion about your health and any health anxieties that you have or any health questions that you have. So please do come visit me.
Okay, coming up next is the business news that will take place right here on Talk 100.3. It's Curtains on today's show. I will see you tomorrow on this very short 7 a.m. on the dot. Until the next time, I'm saying take very good care of yourselves. Dr. Amna, it was indeed a pleasure to have a conversation with you. You opened our eyes, ears, and probably all the different other senses to cancer as a topic. Thank you.
Thank you so much. Thanks a lot. Lovely being here.